So hello, welcome everybody. We were just waiting for people to enter from the waiting room. I will stop sharing the main slide in order to introduce ourselves. So my name is Kornelia Kiss from CultureAction Europe. I'm head of culture and health there. And CultureAction Europe is a European cultural network based in Brussels. We have over 300 members from all over Europe and a little bit beyond as well. And I'm here with my colleague Mari Wittig from CultureAction Europe, helping us with technology, and she will be she will help putting some links in the chat because people often like to see further some documents. And I also very warmly welcome here Rarita Zbranca from Cluj Cultural Center, who is the lead author of the CultureForHealth report and also board member of CultureAction Europe, and Edith Wolf Perez from For Health Austria, who is our guest speaker as well, being the co-chair of the so-called OMC group, the EU member states gathering on culture and health for 2 years, and has been instrumental in finalizing the Culture and Health Time to Act is Now report. That is the main topic of this session. But also, in general, we will concentrate very much about advocacy and policy in this session, and I hope it will be beneficial for everyone. I still see people entering in the room. However, we were thinking to start with seeing who is actually there from your side, and we would very quickly launch a poll to understand who is in the room. So if you could very quickly answer to them voluntarily, of course, that would be very helpful also to know how to formulate our presentation depending on who is in the room. So the first question is about which field are you coming from? The second question is about what describes you most, the best? Are you a policymaker, an artist, a researcher, a cultural professional, and which area you're coming from? So it will be interesting to see the results on that. Meanwhile, 2 more people arrive. Yes. Okay. So I think maybe we can end the poll and show everyone the results. Is it possible to show or?
I thought I think it's already showing.
Oh,
yeah.
Okay. I don't see it, but great. Excellent. Where can it be? So maybe can you read it out or like?
Yeah, so for the first question, which field would you categorize yourself as? We have 70% from arts and culture, 2% from health, 2% from social, and 18% say they're a mix. What describes you best? We have 19% policymakers, 31% practitioners, 17% artists, 33% researchers, and 40% say they're from another discipline. And then we have a full mix of artists, many coming from dance, music, some from theater, and some cross art forms. And then a mix of others as well.
That's great. We are very grateful that also, of course, now I see it as well. Thank you, everyone, for being there from the cultural side, but also we are very happy that policymakers and also from the health side, people have joined. So I'm going to share my screen now to run you through what's happening today. And I will just be very, very briefly talking a little bit of a history of where we are coming from. And then Rarita Zbranca will talk about the publication of CultureAction Europe called Towards a Culture Compass, a Sector Blueprint. And then Edith Wolf Perez, who is the co-chair of the OMC group, will describe the OMC report, Culture and Health, the Time to Act is Now. And then I will also try to follow up with some further on advocacy steps. So just very quickly to say that our starting point, this presentation is the Culture for Health report's policy recommendations, where certain policy recommendations were actually embedded in the currently ongoing Culture and Health platform that has been formed and started a year ago. And we are basically showing a critical mass of all the people working in this field. And I will later on also present the platform as well, but it also gives us a good basis to talk on behalf and on behalf of people working in this field, but also to make sure that we are able to support this field and also connect people across Europe working in the cultural side in the area of culture, health, and well-being. And again, very quickly, some of you might have seen this slide, but I wanted to go again through all the EU policy documents that have gone towards the open method of coordination report, and also to highlight why it is relevant for you. So in the EU, a council conclusion means that each and every member state agreed to its text. So wherever you are from, basically your ministry agreed to this text. And there are some texts already out there which you can take and say, but you already said in this document that culture has a relevance to health and well-being, and therefore you can make them accountable as well. So one of the things that I'd like to highlight is, of course, the comprehensive approach to mental health. And there was an EU communication, but again, the EU Council conclusion says, so each and every EU member states agrees that participation in cultural activities can boost the overall mental health and well-being of people and reduce risk of mental health conditions, and therefore invites member states to provide access to culture and strengthen the protective factors for good mental health, such as participating in sports and culture. Afterwards, and I have to say that the comprehensive approach to mental health was drafted by the health ministries. This council conclusion was drafted by the culture ministries, where they invite member states to try cultural prescribing projects as well. But now I go back again to the health sector. So health ministries are very concerned about the digital, about protecting and promoting the mental health of children and adolescents in the digital era. And that specifically also says that socializing with peers, cultural participation, and creative activities can be beneficial for this group, and invites member states to offer offline methods to creative expression through engaging non-digital alternatives, and also highlights the role of libraries, cultural hubs, and emphasized that participating in physical and cultural activities, reading books, spending quality time with family and friends is a good way forward. And let's say in this area, if we say live cultural activities as alternatives to screen time, so it's not enough just to say that youngsters should be less on their phones, but we should also offer them an alternative, and that's what cultural activities can, alongside, of course, with physical activities, but also cultural activities can provide. We also know from research that it's not just an alternative, but it's also actually beneficial for their self-expression, feeling of empowerment, better mental health. But this EU Council conclusion didn't go deep in that. I also want to highlight one other paper, and meanwhile, I think Mari is going to drop all the links also in the chat. Policy recommendations from CultureAction Europe. It's a position paper from the cultural side in the area of culture, health, and well-being. I invite you to still look at that document, although it's still 1 year old, or actually now becomes 2 years old, because it also highlights for the sector itself some of the questions that always come up. Is arts and art therapies part of the sector or not? How about socially engaged art? Do we consider that part of this field or not? And we have tried to clarify it, and it was very much a bottom-up approach involving all of CultureAction Europe's esteemed members. Many of them we have seen here as well in the Zoom. And in this process, basically, you might know that the EU has just drafted its new cultural strategy. It's called the Culture Compass. And in that process, we definitely wanted to make sure that the cultural sector has its role and has its say. So CultureAction Europe came out with a longer document called Towards a Culture Compass, a sector blueprint, in which there is a chapter on culture, health, and well-being. And here I would like to give over the word to Rarita Zbranca, who has been leading from the CultureAction Europe board in developing this chapter. Rarita, the floor is yours.
Hi, everyone. Thanks, Cornelia. I also want to acknowledge the effort in drafting this part of the sector blueprint to the representative of 12 European networks in the culture and health cultural sector, and also to Giorgio Baccheggia, who's also here in the meeting and who was co-chairing together with me on behalf of Amateo the working group on this topic. I will not go into so many details. You can find the document fully on CultureAction Europe's website. I think what is important is because it has been developed from the network side, it really represents the interest and the voice of a wide spectrum of cultural practices and operators across Europe. So it's not necessarily the usual culture, arts and health practitioners technical point of view, which I found very, very fresh because it puts a very special emphasis on how in the framework of the growing attention to culture in health and well-being, framing culture participation from the perspective of EU human and social rights is key, and addressing the huge potential of cultural participation, receptive and active, but mostly active cultural engagement as key to having higher quality of life, stronger communities, and better health across Europe. And few of the ideas in this document, as you see, they have been structured towards different goals. So towards policy, we were advocating for dedicated EU recommendation on culture participation as a determinant of health and social well-being, as well as guidelines for how arts to be integrated in healthcare systems, because this happens in very different ways in different countries. There is a gap between EU member states, and guidelines could support in bridging that gap and also avoiding instrumentalizing approaches from certain countries or contexts. and making sure that the support, the financial support for this type of activities comes mainly from either multi-sector budgets like regional budgets or from health and social budget, and not from culture's existing budget. When it comes to infrastructures, it was important to strengthen, on one hand, that cultural engagement can happen in a wide array of community infrastructure, but also cultural infrastructures existing in communities through libraries, cultural centers, festivals happening in rural and urban areas. They are already places where arts engagement supports well-being at individual and community level. There's also more technical proposals, such as establishing competence centers in arts and health at national and EU level. At EU level, establishing an observatory on this area. When it comes to research, an emphasis has been placed on recognizing artistic research and artistic research methods alongside the traditional biomedical research. We see mainly from the medical side that sometimes the qualitative evaluations and research are kind of frowned upon or received with a little bit more skepticism. And we are advocating for a better recognition of artistic approaches, as they would be enriching research and outcomes for everyone's health. And also the importance in the wider national and European frameworks, like the ones dedicated to statistics and measurement, that there are being conceptualized new ways of understanding and measuring well-being, and together with cultural participation. So these associations between cultural engagement and well-being and health outcomes can be really researched on a longer term. And of course, to grow awareness raising through campaigns. And there has been proposal for different thematic focuses on like the developing projects that are dedicated on certain topics like youth needs, developing resilience for workers, and so on. And a critical point that has been standing out in this collective effort has been that we should never conceptualize the well-being that art can deliver in the society from different from the health and well-being of the artists and culture workers, and that there always has to be a chapter on an area of activity that looks into protecting and caring for the health and sustainability of the professionals from the cultural sector engaging in this type of work. So I will close here, Cornelia. Thanks.
Yes, and the next slide is actually about what has the Culture Compass, which is already out now and easily accessible, has taken on board. And basically what we see, something very similar. One of the points was in the blueprint. They specifically say that an action in 2028 should be to develop EU guidelines on culture, health, and well-being for policymakers and stakeholders. So that is the concrete action within the Culture Compass under point 2, which says the EU that empowers artists and cultural professionals and supports people. And within that, a sub-point is about enhancing health and well-being through culture. It, however, also refers to the open method of coordination report, which is called Culture and Health, the time to act is now. And it also emphasizes that it should continue encouraging regular exchanges of good practices in this field and support cross-border collaborations through the Creative Europe program. And since we talked about the OMC report, there's again a next step that came out. I think that was a little bit earlier than the Culture Compass, but from the way the presentation went, it was easier to link it to that. So the next person who would be talking and going through the Culture and Health time to act is now report is Edith Wolf Perez, who was the co-chair of from the side of Austria of this open method of coordination group, which was a 2-year process. So I would give over now to Edith, and hopefully you can also share your screen. Absolutely. Great. Thank you. Put it to presentation mode if you can. Wonderful.
Okay. Can you all see? Sorry, just where am I? Can you hear me?
Yes.
Oh,
But
great. So I wasn't even, yeah, no, that's okay. That's okay. So, yes, hello. Can it all good? All set. Well, hello from me again. As Cornelia said, for the last 2 years, we have been working in this OMC group on the topic of culture and health. And I had the privilege to serve as a co-chair, privilege and yes, no, it was a privilege. We were experts from across Europe tasked with a single urgent question. How can we bridge the profound gap between these two essential parts of our society? Our work wasn't theoretical. It was a deep dive into the evidence. You have heard what has already been going on, the case studies from all over Europe, and the barriers between the sectors. And what we found was undeniable. The message of our report is simple and direct. Engagement in culture and the arts is a health behavior, as much as sports, a good diet, or sufficient sleep. And the second message is it's time to act now. Our mandate came directly from the Council of the European Union. You have heard it. All member states or all cultural ministries of the member states agreed to put this OMC group into work. OMC stands for Open Method of Coordination, and it is a way in which member states work together at EU level, exchange experiences, and learn from each other. And what the Council of the European Union asked us is to move beyond just identifying problems and to deliver a concrete, actionable plan that would promote a better cooperation between the sectors. So why is this so urgent? Because from our research, the status quo is unsustainable. We documented current challenges in the different areas. For instance, for the cultural sector, we documented precarious funding situations and the struggle for relevance, the challenge of digital disruption, threats to the artistic and curatorial freedom. For the health sector, we identified a burned out healthcare workforce. A crisis of human spirit is this, not just finances. A detrimental state of mental health. It's a silent epidemic, and especially among our young population, a looming burden of non-communicable diseases in the face of an aging population. But the most significant findings that came up again and again was the obstacle in between, in the space for intersectoral collaboration. These challenges are not just bureaucratic, they are really cultural. Some points of it are that there is fragmented governance, the ministries that literally speak different languages. There is an almost complete lack of supporting structures to make this communication and collaboration easy. And there is a systemic resistance of change. I believe that this is just how things are done. We concluded that these parallel crises are not separate. They are symptoms of the same problem, a lack of holistic thinking. And so our solutions must be interconnected. Because when we intentionally bring culture and health together, we unlock unlock what we call a triple win scenario. We identified 21 opportunities that the inclusion of culture and the arts would provide. For the cultural sector, this means new job opportunities and sustainable, mission-driven business models, the development of new artistic practices, artists as essential workers for well-being, improved access to culture for new audiences in new settings, and a more diverse and resilient cultural ecosystem. For the health sector, this means direct health benefits like measured reduction in stress, pain, and social isolation, a move towards truly personalized and holistic care, a tangible reduction in drug dependence, and crucially, reducing the burden of our overstretched systems and workforce. And finally, reducing the stigma by humanizing healthcare. And this is especially true when we look at the mental health stigma. This synergy has global ramification. It's about strengthening social cohesion in an age of polarization, supporting our democratic societies by fostering shared experiences, offering meaningful alternatives to screen time, and for every finance and health minister, it's a smart investment in prevention. Mental health problems currently cost the European Union around 600 billion per year, euros, that is. This is equivalent to around 4% of the GDP, and the demand continues to grow. That is enormous. This is why the financial aspect has been given particular attention in the EU, and in a study from 2024, the monetary benefits of culture and cultural heritage for health were quantified. I cannot go into details here about the results of these complex models, but you have this, the title page here, so you can find it online for download. It's free. Let me just pick one example. For the UK, the authors calculated the annual benefits of arts and culture for the general health of adult population of 1,150 euro per person, society-wide 9.5 billions. For the mental health sector, this means per person 750 euro or 2.5 billions. Now, these are not negligible numbers. And I would also remind everybody, here are some policymakers that really, every time we cut the culture budget, this has ramifications for the health sector. And in times of austerity, this is the first thing to go. But we are not alone with our conviction. Last year, the World Health Assembly passed a resolution that echoes our report's core message. It explicitly urges member states to strengthen collaboration between the culture and health sectors. And in November 2026, the WHO also launched its guidance on policy and strategic actions to protect and promote mental health across government sectors. And this guidance is grounded on the principle that every sector has a role to play in promoting and protecting mental health. And it highlights the crucial links between the mental health and the culture, arts, and sports sector, recognizing that many core activities of the sector inherently protect and promote mental health. Thus, the global community is aligning. The evidence is on the table. The question we faced was, what to do now? And this is the action plan that we came up with, and this is really at the heart of the report. We identified 7 actions to build and implement an EU strategy, establish corresponding national culture and health strategies, enable intersectoral collaboration and pooling of resources, design and implement culture and health programs, build capacity, advocate for culture and health, and strengthen the evidence base. Now, what you have heard before from Rarita and also from Kornelia is integrated in this OMC report. These are just the headlines. There are very specific actions to which can be followed. Now, but now the work begins, and we need to move it now. In our report, we can also go back to models that already exist. Like, for instance, in Finland, since 2015, there is this multi-sectoral coordination center and national network for arts and health. And there is also in France, there are several levels of cooperation. Since 1999, France has entered into a series of national agreements between the Ministry of Culture and the Ministry of Health to promote access to culture and cultural engagement in healthcare, disability care, and elderly care. And only in July 2025, a new national agreement was signed. This will run for 4 years. Potentially, it can be extended to 12 years. While we were still writing the report, Ireland has come up with a strategy for cross-sector cooperation. The two sectors, named Creative Ireland and Healthy Ireland, put 2,000 million euros in a pot to realize projects in 15 local authorities. And after the launch of the report at Mondia Cult in Barcelona in September 2025, the Culture and Health Ministries of Spain signed a collaboration agreement. This year, the NGO Arts in Health Netherlands received public funding to support the structural anchoring of arts and culture in the health and well-being sector. And several launches of the report in Finland, Austria have already happened, and more are coming. And as Kornelia already mentioned, the EU Culture Compass has a culture, health, and well-being section, and one major action is recommending one major action in this field. This report is paper, but the culture and health movement is a living, breathing initiative, and we need all of you to make it bloom and foster. This is an invitation to you. Become part of the culture and health movement, advocate, and if possible, organize a report launch in your country, go to your ministry, try to convince the policymakers about this initiative. It doesn't need to be the national level. Go to your local level, go to your regional policymakers and talk to them. The scene is set, so let's just move it on. Come to the major conferences, mark them in your calendar. There is Leuven. I think, Kornelia, you will go into that later on, and also Vienna in September. Participate in all our activities that Kornelia will present afterwards, and stay in touch. Keep us all informed about your actions in your country so we get a real network going. And with this, I give over to Kornelia and say thank you very much.
Thank you so much, Edith, for this extensive and very to-the-point presentation. I'm wondering if there are some questions for Edith or Rarita or myself so far in the meeting. We are happy to answer to them. I see some clap of hands. if you would like to ask some questions, you can also ask in the chat, but also feel free to just unmute yourself and tell us. If not, we have further things to say as well. But I'm leaving a couple of minutes for that. Okay, so maybe the question comes during that time. So Edith was very vocal about the fact that we really now need to use this OMC report in which really EU member states are saying what should be done. So therefore, it has a much bigger weight than if it comes from other sources. As she was also mentioning, it's really not only the national level that we could try to influence, but also very much the regional levels, especially that I think 70% of the health financing is done on regional level as well. So depending on your personal circumstances of where you can influence and be a change maker, think of how you can reach out to people in the health sector who might also be a champion and also advocate within the health sector for this area. I'm going to, so unless there are some further questions, I'm going to share my screen again, talking a little bit of what's happening now, what's happening in parallel and after the OMC report, Culture and Health, the time to act is now. So one of the parts where we are trying to where we are trying to show how wide this area is through the Culture and Health platform. And I will also explain a couple of opportunities that goes with that. But before I go there, I would really like to highlight some of the key resources that were gathered together during the Culture for Health project, which is the previous project of 2021-2023. But why it is relevant, it is also, it was initiated by members of European Parliament, so it also was an EU preparatory action and therefore had a political weight as well. I'd like to highlight that there is a database of actually currently more than 850 projects in the area of culture, health, and well-being. And this database we continue to fill, and big thanks to Cluj Cultural Center for that, actually, who is managing that part. And we invite you to also share your projects in that database because on the one hand, it also shows the variety and the breadth, basically the weight of these projects, but also it can serve very much like a tool to learn from each other across the sectors. We don't want to reinvent the wheel. It's also quite nice if you have a project idea to check out if it already exists already and learn and get in contact with some of the people who have executed that as well. I'd also like to highlight, of course, that there is the arts and health supporting the mental well-being of forcibly displaced people publication as well, which has become a World Health Organization publication. And there is also a guide for practitioners that can be used. So I just wanted to say that from the Culture for Health project, basically 2 babies were born. One of them is the Culture and Health platform, which has now more than 15 organizations part of it, and also the CARE project that is led by Cluj Cultural Center by Rarita Zbranca and her team. And how the Culture and Health platform came into being was through the policy recommendations of the Culture for Health report, because we saw that there needs to be financial support dedicated for this area because it falls in between 2 sectors. And we also saw that there needs to be awareness raised in the health sector and with the general public as well on the cost effectiveness, but also the benefits of cultural engagement for health. And also we saw that there is a huge potential for peer learning across borders, and also how training can help this sector. So therefore we have created a dedicated platform for exchange from the Creative Europe Platforms grant. What is good about it is also a 4-year long project, so it has some kind of a sustainability for a while, and the objective is to support and promote emerging European artists working in the interprofessional space of culture, health, care, and social sectors. It is required that we support minimum 200 artists during the 4 years, and I will show you what we have achieved in the first year already. Here you can see all the platform members who are part of the platform and also receive also funding from this Creative Europe Platforms grant, and also distributing it further to artists locally, and also some organizations like Red Noses International is part of the training program and provides a longer-term training program for some artists. Here are the actions that you can see. We give financial support to dedicated projects, and on 2 levels. In the place where we have national organizations, they are distributing it locally, while on EU level, we also have a call, and it's actually open now. I will talk about it a little bit later. We also aim to support and build artist capacities through online trainings. They are free of charge, so open for everyone. And we will be sharing in the chat, of course, where you can find all this information in the Culture and Health website. We also have peer learning and shadowing program where one artist can learn from the other by visiting them. And we also try to make sure that the artists receive mentoring and support on a national level. Every year we have one big showcasing event where we showcase the work of the artist, and this will take place in Vienna in September this year. We will share later on the exact dates in the coming slides. And also one big part of our work is awareness raising for the health and the social sectors, where we are working with the European regional and health authorities who can provide us access to some of those stakeholders. What has happened in the first year? We have supported 56 artists already financially to implement their projects. We also see that in this field, actually artist collectives, so people like to work together also because of the complexities. So therefore, more artists were benefiting from these grants. And we had 11 calls for projects, and 479 artists received either funding or more than 3 hours of capacity building. But if we count also the 1.5-hour trainings, we have supported 1,077 people. And in our conferences, more than 180 people came together, and we had 18 online trainings, 2 cross-border travels organized, and also our LinkedIn is over 3,300 people. And also artists who were selected because it was also an EU grant, actually received much higher visibility on national level. So we do have also artists who were asked to talk on TV or on the radio, or also they had been asked to do some online newspaper question and answer session with them. And we are very happy to present that in this second year, we also have a so-called EU call for projects. So where are no national calls are happening, we also offer for also all other countries this possibility to apply specifically for artists. So this is not for cultural organizations. This is mainly to support artists directly. So we are distributing 8 times 8,000 euros in a 2-stage selection process. And one of the requirements is to make sure that they are partnering already with an organization from the health, social, or educational sector in order to make sure that this is maybe longer term sustainable, because also there is a buy-in from the other side. So we will be very strategic in supporting the right projects. And as mentioned earlier, there are national calls also open now, and we are sharing the link in the chat. In Finland, Spain, Netherlands, Ireland, Austria, and Germany, and Italy. And a little bit later will come calls in Sweden, Malta, Romania, and Poland. So here you can see the countries in blue all have their national calls. And in all other Creative Europe countries, the EU call can be applied for. These are some of the actions that are upcoming in the platform and also in the CARE project. We have some open peer learning opportunities, so what we call artist roundtables. One of them is culture and health in community-based settings, and the other one in education and youth-focused spaces. You can see some examples of our trainings there. I already mentioned the calls for projects, but I'd like to highlight also the 2 conferences that are happening. So basically, the OMC report, Culture and Health, Time to Act, will be launched also in Flanders on the 26th and 27th of February. And there is, of course, a wider conference building up called Culture and Health, a joint call for change. With the Minister of Culture present, also Commissioner Mikalev will be there, and people from the World Health Organization. So we have managed to secure quite a high presence. And in Vienna, we will showcase the work of the artist in the Culture and Health Forum, 7th to the 11th of September this year, where is also a CARE mobile hub, 3 to 5 of June. Very quickly, I'm running through what the CARE project is about. So while the platform is more about the network, the CARE project is about taking solutions that seem to have worked and scaling them up and trying to make it wider and try to test it in more countries. Here you can see some of the partners of the CARE project, but I just wanted to mention that there are basically 3 laboratories in this process. One of them is on youth mental health, the other one is about work-related well-being, and the third lab is about culture and prescription, and these topics are tested always in 2 countries. There is also an element of advocacy and exchange, as well as capacity building, especially for festivals, and also we deal with the care for the cultural workers. One big step that we just launched is the More Arts, More Wellbeing campaign, which is supposed to be an awareness-raising campaign, stressing how engaging in cultural activities is good for your mental health and well-being. And these are some of the visuals that we've been working with. We also worked with an Australian example, actually. Now we have only 10 minutes, so I will very quickly run through how does the puzzle fit together from advocacy point of view, and many of the things actually were covered already by Rarita and Edith as well. But I just wanted to explain how the culture and health platform is basically a gathering of the cultural side, could fit into a wider stakeholder platform where, of course, the health side and social side and policymakers would also all be represented. There was a Horizon call last year, and the results for this Horizon call is going to come out in February. But whoever wins this Horizon call is tasked to have a stakeholder platform where all stakeholders are called on board. So therefore, it definitely the culture and health platform fits in this wider, bigger puzzle that are ongoing. And on the part of the advocacy, Edith already very well covered how the OMC report could be a very useful tool to go further and make sure that these OMC reports is not only launched in an event, but also, of course, followed up through the processes that it starts. We know it's not going to happen from one day to another. It will take time. We have to be patient, but we have to go step by step. And then, of course, we are very much aware that we need to raise the demand also on the health side and raise the awareness of everyday people as well. So that is basically the puzzle that also CultureAction Europe is going to pursue, and we are also inviting everyone on this Zoom to join us and become a change maker and ideally push the ball in a certain direction that is the right direction. I wanted to cover a couple of things of what we have learned during 5, or actually probably now 7 years of advocacy working in this field. It's very important to remember that people don't necessarily get what we are talking about for the first time. I always say, talk to someone at least 5 times till they really get it, and also till they really understand all the aspects. Some people will right away get it, and that's great. But it is totally okay that they also need to go through a process understanding how culture can contribute to health and well-being. And language is a very important entry point. So it's also good to learn in the beginning, use the language of the other sector at the first discussions in order to understand. So here you can see some examples, and also it is important to highlight that a key message to a policymaker that now the evidence base is good enough to start thinking about implementation, and this is what also the OMC report highlights. But we need to create an enabling environment for these initiatives to happen, and this really has room for improvement. We are a little bit like a wild west at this moment, and also people working in this field need to think together how the best way forward should be, that everybody is remunerated and can work together on an equal level. Using storytelling and immersive experience, like being part of a workshop, it helps a lot as well. And of course, just highlighting also the same data that Edith was saying, that mental health crisis costs 4% of the EU GDP, so 600 billion euros annually. So there is really no time to sit around. There is also learning to match your arguments to your discussion partner, and making sure that you use the right words that resonate with their agenda. For example, in the case of youth, talking about alternatives to screen time. In the case of older people, active, healthy aging, or mental and social health for older people can be very useful terms to use. But for example, I just took defense here as well. And for example, talking about resilience of people in this area and a strategic defense against disinformation and hybrid threats can also be a relevant way to talk about. But there are some caveats, and this was explained in several spaces already, the instrumentalization of culture, and of course, regarding budget, cutting the cake into more slices versus enlarging the cake. We are aiming to enlarge the cake in this area, and also making sure that there is actually such a huge budget difference between, let's say, the culture and the social or the health side, that also a very little part that maybe the health budget doesn't even notice can make a huge difference in the other side as well. And it's possible to work together for a better society. So 3 key messages was mentioned before, but engagement in cultural participation in the arts is a health behavior, like physical activity, eating nutritious food, or being in nature. And we also, from an Australian research, we know that the doses should be 2 hours per week or more, 2 hours per week. Engaging in the arts actively is linked to better mental health and well-being. And in Australia, there was a public health campaign already financed through the health side on this. So there is, at least in epidemiological research, this is definitely accepted and has been taken forward. And that campaign has been very successful. So we also try to have a similar campaign as well. And you don't have to be good at the arts for arts to be good for you. This comes from Christina Davis. And that's something we can very much be vocal about. I have 3 minutes. So I just want to very quickly say what you can do. Please foster the OMC report launch in your country and also the follow-up steps. Raise awareness and advocate for this field. Find the champions in the health side and let them bring forward the ideas because they know how to navigate in that system. It's also very good to pair health between health and the cultural side. Do share your project on the CultureForHealth database. We are filling it for the next 4 years, and share the social media campaign as well as the Ask, Pay, Trust campaign of the CultureAction Europe. And with this, I think I will close my presentation. We do have 2 minutes in case there are some questions. Oh, wow. Thank you for the hands. Are there any questions, or were there some questions in the chat?
Yeah, maybe we can refer to the question by Louise from Central Denmark region. She put a question in the chat.
Do you know what the process towards the EU guidelines on culture, health, and well-being will be? I think not even the European Commission knows, but there are things that are coming up. So one of the stepping stone could be that there will be a Creative Europe review very soon now, like half-time review. So, for example, in there, we should make sure that this topic is highlighted. And then comes the work plan for culture discussion by the EU member states. The current work plan for culture is, I think, until 2027. And they are already starting negotiations I think next year or so. So we have to just make sure that that work plan for culture also contains maybe another open method of coordination group with a similar topic so that also member states can contribute to these EU guidelines. And yes, we are very hopeful that DJ Santa will also collaborate actively in that. We must say that the health side currently is very let's say, out of the picture. You can imagine after COVID, all money went there, and now all money goes to the defense side. And they are even struggling to have a follow-up on the comprehensive approach to mental health. We are trying to help them in this process because also it can be relevant for research as well, because if the mentally unhealthy society is more prone to any kind of disinformation. So yeah, long way to go. But also, we also think that we don't necessarily have to need more money in health, but a better reorganization and more focus on prevention, so that people just don't get to a level where they need real primary care. That could be one of the solutions. Are there some more questions, maybe? No? Okay, in that line, then I think we will close the meeting. Thank you very much for being there. We really appreciate putting your time in your lunchtime for this. And yeah, hope to see you soon, and stay in touch with the CultureAction Europe and the Culture and Health platform and its members. Thank you very much.